Thank you, Mr. Deputy Speaker. Like almost everyone speaking in the debate today, I support measures to ensure people have a healthy relationship with the food that they eat. However, Mr. Deputy Speaker, healthy eating habits can't simply be measured on weighing scales or counted in calories. Today, we are facing a mental health crisis, and one element of that crisis is the rising epidemic of eating disorders, including for some of those facing obesity. I fear that this falls well short of the social and mental health support for those who help manage healthy relationships with food, any conditions relating to weight management, whether that's diabetes or heart disease or an eating disorder. I hope that the new funding for services will see these approaches supported. And whilst I'm fully supportive of interventions such as restrictions on advertising and work to improve the diet of the nation, I remain very, very concerned about the certain aspect of the strategy. Before the pandemic crisis, hospital admissions were increasing, especially amongst teenagers. In 2019 to 2020, we saw a sharp 32% increase from the previous year, over 21,000 cases. Nearly 5,000 of those cases were children. In addition to hospital admissions, between February 2020 and January 2021, the eating disorder charity Beats reported a massive 173% surge in demand for their services. During that time, we've seen no corresponding rise in the levels of funding going on eating disorder services. And I've sat with eating disorder specialists who have told me that the money that is available often fails to get to the front line. One doctor I spoke to said his service was originally designed for 60 children and now serves 280, with inadequate funding for those places. I know that NHS trusts are also struggling with non-specialist inpatient services for children. The rising demand means they just don't have the expertise available to treat inpatients with eating disorders properly, with many waiting for urgent beds for children in crisis in any specialist unit anywhere in the country. And we still see a situation in adult services where there is no waiting time targets for support for eating disorders. The reason I'm highlighting this dire situation is because one measure of the government's obesity strategy involves calorie labelling on menus. Included in those who will read these will be people with eating disorders. There's a wealth of research showing that calorie labelling can exacerbate unhealthy relationships to food and can be a predictor of the onset of eating disorders. In trying to fix one problem, there's a real danger that ministers will make another far worse, the costs of which are not trivial. Eating disorders have the highest mortality rate of any mental health problem, and people who suffer from them are at increased risk of both suicide and self-harm. While it's true that half of those with eating disorders recover, 20% remain in a chronic condition. Mr. Deputy Speaker, we should look at obesity in the round. Balanced, nutritious meals, promoting healthy diets like Mediterranean diets and healthy levels of exercise are far more important ways of maintaining a healthy weight. I urge the government to rethink and revisit this aspect of the plan, come up with a solution which balances the needs of all. If we really want to promote healthy eating habits, calorie menus are not necessarily the way to do it for the whole population, and risk making a very bad situation even worse for those suffering at risk of developing eating disorders. I say this as someone with type 2 diabetes, and I have lost weight in order to manage my diabetes. I do have to say, I do think there is a real issue with anxiety around calories, weighing out food. I think more needs to be done to recognise those anxieties and mental health issues.